An EndoBarrier is a recently developed technique that's aimed at trying to improve patients' diabetes and also help with weight loss. It's an interesting idea because what it involves is endoscopic insertion of a special sheath that lines the inside of the bowel itself. The endoscopy involves sedation or general anaesthetic in which a camera is passed down through the patient's mouth and throat into the stomach. Once it's just beyond the stomach, this special sheath, which is made of polyurethane, is deployed within the lumen or the cavity of the bowel itself. The idea of the EndoBarrier is that by lining the upper intestine with this artificial polyurethane sheath, it will prevent food that you've eaten actually touching the lining of the bowel itself. The food will pass down the sheath itself and not come in contact with the bowel lining at all. We don't really understand why the EndoBarrier helps diabetes and does result in some weight loss, but the theory is that by not allowing food to touch the lining of the intestine, it may alter the balance of hormones produced within the bowel wall, some of these hormones controlling appetite. The EndoBarrier should still be considered an experimental procedure. The number of patients who've been treated, published in the world literature, is still very small, and the results in terms of weight loss are nowhere near as significant as those achieved with standard bariatric surgery. The other problem with the EndoBarrier is it's expensive. It costs almost as much as having a gastric bypass procedure. It also has to be removed after a year.